Hello. Good morning, good afternoon, good evening, wherever you are. And you're welcome to Dr. Abayomi Ajayi Live. And today, we're talking about living with polycystic ovarian syndrome. Well, we know that September is PCOS Awareness Month, but we could not get to do this, but it's better late than never. So, and because PCOS is a very important topic, that we thought it was worthwhile to discuss about it. And because, of course, we wanted to talk to somebody who had gone through this and had succeeded and has our own children, and we just had to do it today. So once again, you're welcome. You know, when we talk about polycystic ovarian syndrome, it's one of the most confused conditions, though very common. Probably the commonest hormonal disorder in women of the reproductive age group, said to affect about 6 to 12% of women. And the symptoms include infrequent or prolonged menstrual period, or signs and symptoms of excessive male hormones. By this I mean either you're seeing that a woman has facial hairs, body hairs, or it's demonstrated in the lab that a level of male hormones is higher than what normally should be. But the commonest way that people diagnose this is when they do scan. And that's where I actually have a problem, because it's not all polycystic ovaries on scan that actually are PCOS. Okay, as we go on, we're going to discuss about what are the signs and the symptoms. How do I know if I have polycystic ovarian syndrome? We're going to do that. But in the interim, let me introduce a very special guest today, Mrs. Alero Familusi. Hi.
Good afternoon, Doctor. Thank you very much for having me.
Yes, it's always a pleasure to have you and to chat with you. Please, Alero, can you just introduce yourself and then walk us through. Then my first question will be, how did you know that you have polycystic ovarian syndrome? So just walk us through that.
My journey into discovering that I had PCOS was rather convoluted. The first time a doctor mentioned it to me, it was in passing. So I had been married a couple of years and we had started the search for a child. And so I went to this doctor and he mentioned he had done a scan. That was all he did. He did a scan and he said, oh, you have PCOS, but it should not be a problem because it's not severe. And I cannot tell how he knew it was severe or not. And it was the first time I was hearing about PCOS. So I go back to the office and I did a Google search and there was no good news online. So I'm wondering, how did he come about it not being severe, not something I should worry about? So, you know, I continue, we find out that I had fibroids as well. So I do the surgery for fibroids and still no baby. So we came to Nordica. Actually, went to another hospital before we went to Nordica. It was the hospital that after about 5 cycles of induced ovulation, suggested we try IVF. So when we came here, I think there was a hormonal assay that was done. There was a scan that was done. My history was taken. And they came to the conclusion that I did have PCOS.
Okay, great. Okay, before I'll ask you further questions, maybe one of the things when people hear about PCOS, or why is this important that we make a diagnosis of this? You know, because early diagnosis and treatment and weight loss may reduce some of the long-term sequelae that can follow polycystic ovarian syndrome. And that's one of the things, that probably is going to be one of the questions I'm going to ask you, whether you are aware that there could be some even sequelae after having children from polycystic ovarian syndrome. We'll get to that. So, but of course, there are long-term complications like type 2 diabetes and heart disease. Yeah, but yeah, please go on.
Yes, I actually did find out about the heart complications and type 2 diabetes online.
Okay.
The heart complications I found out the last time that I was with you on this program. There was another lady that was with you, and she
Mhm.
mentioned I think she had a stroke after a couple of cycles, and so that was how I found out. So every time you go to hospital, the only thing you hear about is for fertility's sake. No one lets you know that there are other consequences aside fertility for PCOS. So until I
True.
was doing personal research, I didn't know. But there was actually a doctor that was said, "Oh, you're fat, go and lose weight." So I'm like, "That's it." So I lose weight, then I have a baby, and I lost weight, and I still didn't have a baby. You know. So there's a whole process. There's a whole lot more to PCOS aside just fertility. So even my weight is something I constantly struggle with
Yeah.
before, after, during pregnancy. Yeah. So it's aside the weight, I had gestational diabetes
Hmm.
um when I was pregnant,
Yeah.
both times actually.
Really.
So
Hmm.
yeah.
Yeah, that's one other thing that we probably need to talk about. Yes, because this, and that's one of the reasons why um, the diagnosis of PCS should just not be made lightly. Because one should hesitate to label anybody polycystic ovarian syndrome if the person does not have, because what you're saying is that this person might be predisposed to some other conditions even after fertility, just like you just told us now. So does a woman know that I'm going to answer the question myself. How does a woman know that she has polycystic ovarian syndrome? So irregular periods, it's the commonest presentation of polycystic ovarian syndrome. Usually women with polycystic ovarian syndrome will have fewer than 9 periods in a year, usually, or the cycles might be longer than 35 days. And sometimes these periods are very heavy. Like I said during the intro also, some of these women will have excess male hormones. So they could have facial hair, body hair, and they could sometimes have very severe acne and male pattern baldness. And that might be what will trigger the fact that they do lab tests that now show that the androgen level is increased. Well, and just like I said earlier on, the commonest thing is that you just do a scan and the doctor says, "Oh, you have polycystic ovaries." Okay, just like you told us, But from what we have seen, that you need 2 out of these 3 things in order for us to say you have polycystic ovarian syndrome. So it's either you have irregular periods, you have either evidence of excess male hormones, or you have a lab diagnosis of that, or you have polycystic ovarian ovaries on scan. Now, people always ask what causes this. The truth is that we don't know, but we think there's some things that can be involved. And one of the things that we think that might be involved is excessive insulin. Okay. And because many years ago, when we first started using metformin for PCOS, I know quite a number of doctors, I know quite a number of patients took us up on this and said, "Look, why are you giving me anti-diabetic drugs?" But we've seen that PCOS and diabetes, they share something in common. And that's why somebody who has PCOS can be predisposed to diabetes later on in future, because they have what we call resistance to insulin. Okay, and because insulin is the hormone that makes you to utilize the sugar that you eat. It drives sugar into the cells, and then now when you are resistant to it, it means you need to produce. The body sees as if you don't have it, and then you have to produce more. And this insulin also makes us to produce more androgens or male hormones. And this is we think, is one of the reasons why some people have polycystic ovarian syndrome. Of course, that's why it runs in families. But let's talk about the complications, which is what we are talking about. One of the complications that, or the aftermath of polycystic ovarian syndrome is infertility. Okay, most of the time, this is what we concentrate on. Okay, you can't get pregnant because most of the time you are in your reproductive age. Okay, and what brings the patient to the doctor is infertility. But one thing that, like you said now, is that the doctor should also be able to educate the patient on what the after effects of even when you have overcome this infertility could lead to. Okay. So I'll put it to you, Mrs. Famulusi. Do you know? I mean, now you told me that you heard about the heart disease. Is there any other thing that you think or that you know that women with polycystic ovarian syndrome could be predisposed to from your own experience?
Even during pregnancy, after you have surmounted the fertility issue, during pregnancy, you will require, well, at least I required a lot more monitoring. So for almost every antenatal visit, there was a scan. I had my diabetes test done about 2 or 3 times because, like you're aware, I lost my first pregnancy at 35 weeks. Now, when I got pregnant the second time, I left the country to go and have this baby. And what the doctor mentioned was because I had PCOS, there was a likelihood of developing gestational diabetes later rather than earlier, whether in my second or in my third trimester. So for each trimester, when I traveled, they actually did a diabetes test for me, as opposed to the one that I had done here. So aside that, I still battle with facial hair. This makeup hides all the hair that that we're trying to hide, but facial hair is something I also battle with. Like I mentioned, weight. So I have to constantly be sure that my diet does not predispose me to diabetes. I'm careful because heart conditions, hypertension, these are things that I have to be careful of. But one thing that I am not able to surmount is very heavy periods. I still have very, very heavy periods, even though it's rather regular because it's about 32 days. It's less than 35 days, but I have very, very heavy periods. They're not as painful anymore. I used to have very painful periods. I'd go to hospital and all of that. So, but now it's just very heavy, but not as painful. So my issues from PCOS were heavy periods, of course, infertility, hirsutism, that's facial hair, and gestational diabetes.
Ah, okay. Yeah, you are the doctor now, aren't you? Yes. One of the things, of course, which you said again is that, okay, miscarriages are commoner in people who have polycystic ovarian syndrome, just like you alluded to. I mean, and of premature birth. And like you said, also in pregnancy, there's the tendency for gestational diabetes and pregnancy-induced hypertension. Now, but in later life, it's possible for some other things. There's a condition called metabolic syndrome, which is a cluster of conditions. There are the metabolic conditions, including high blood pressure, high blood sugar, abnormal cholesterol, that actually significantly increase the likelihood of heart disease and so on and so forth. So you're on the right path by battling your weight, okay? Diet is so important, and if you can add exercise to it, that's just lovely. You must constantly be in control of weight when you have polycystic ovarian syndrome. And like we said, type 2 diabetes is also one thing. It's also a possibility. Now, there's also a condition now that is becoming, I don't know, commoner. There's so much awareness coming with it, which is called sleep apnea. Okay. Sleep apnea, you heard about sleep apnea?
I have heard about sleep apnea, and I think I actually just found out about the relationship between sleep apnea and PCOS about 2-3 days ago. After you called, yes, after you called and asked that I come on, I couldn't come on ignorant. So I did a quick Google search, and I found out that there was a relationship between sleep apnea. It's one I don't understand, but I saw that there is a relationship between sleep apnea and PCOS.
Yeah, well, sleep apnea is something that's been knocking on our doors for quite a while. And initially, I didn't believe it, but of course, evidence is overwhelming that there's something called sleep apnea, where when you sleep, you tend to your airways close, and it's like your oxygen supply is not good enough when you wake up. So you see some people, they wake up, they're groggy, it's like if you didn't really sleep, or by midday you're already feeling sleepy, because you thought you slept throughout the night, but really and truly you were just tossing and all over the bed because your oxygen supply is like once in a while you cut off, the oxygen supply is cut off because either the tongue falls back, or usually it's more common in people who are obese, Yeah.
So that's
So,
what I wanted to
but
find out. Is it because patients with PCOS are more likely to be overweight? Is possibly why there's a sleep apnea.
precisely. So I think most of the things that you can control will come with weight, watching your weight. Okay. So once you are on top of your weight, most of the complications, not all, will be taken care of. And one other thing that we don't talk about most of the time is depression. It's said to be commoner. Eating disorders, depression, anxiety, it's said to be commoner in people who have polycystic ovarian syndrome because of this hormonal imbalance that they have. So if you can keep on top, and seriously, weight loss is the key to everything, and that's why we tell some people that you just need to lose about 5% of your weight, and you see some changes happening in your ovulation, your hormones, and even your ability to have children. If it's all limited to polycystic ovarian syndrome and hormonal changes, but sometimes it's also more than that, and you need to do some other things. So yeah, so I think you know quite a lot more than the average woman, and so probably one of these days you also, maybe we'll just give you the MBBS as a honorary MBBS.
If it comes with money, I'll take it.
Oh God, oh you of little faith. All right. But also,
when you talk about weight loss, isn't it a bit hard for people with PCOS to lose? It's a catch-22, isn't it? So it's harder for people with PCOS to lose the weight, but it is the weight loss that is needed to make a difference.
Exactly. It's much harder for people with PCOS to lose weight, and they need to put more work into it. But one thing is that most of the time it's what we eat that makes who we are, and then what we do with what we eat. So it's a matter of still watching what you eat, eating healthy, and then a little bit of exercise as well. There is also a form of cancer that might be commoner in people who have polycystic ovaries. It's called endometrial cancer. But this is usually with people who don't bleach regularly. Okay, because it's associated with not ovulating regularly. So and that's one of the things. We know that it's not everybody who has PCOS that is obese. There's some people who are slim and still have polycystic ovaries. And that's probably one of the toughest conditions to diagnose, because sometimes doctors tend to overlook them, except maybe when they have a scan or something like that, except, of course, if the doctor has a high index of suspicion. Maybe we should talk about treatment a little bit. We've talked about weight loss over and over, and we've talked about exercise. So lifestyle changes are very important with people who have polycystic ovarian syndrome. Yeah, but also we now look at how we can make the menses regular. And this depends on whether the woman wants to have children or she does not want to. So that's one of the things that if a woman does not want to have children, then we can use the other pills to make the menses to become regular. But if she wants to have children, then we need to do ovulation induction, of course. That's where some drugs, I don't like mentioning drugs, but that's where some drugs and injections come in. And like you said, the citizen is also one thing that people with polycystic ovarian syndrome have to look out for or fight. Pills also help with this. The oral pills help with this. And also there is a procedure called electrolysis, which is also can be used for this. So I think let's look at, so did you go through any lifestyle modification? You'll be talking about also watching your weight. Did you tell us how you went through this? How easy has it been?
It's not easy. It's my weight is up and down all the time. Sometimes, you just get tired and let me breathe for a little, and we'll get back to it. So I do try about 4 or 5 times a week to exercise. I will not lie. I am not faithful with my diet. I try, I fail. I try, I fail. Sometimes I was more faithful when I was looking for the children. Now that I have them, I am not as faithful. I will admit, but I am more faithful with my exercise than I am with my diet.
Lucky you.
I know that I need to work on it. It's constantly at the back of my mind. But
please don't let it be at the back.
We'll bring it to the forefront. We'll bring it to the forefront, yes. So, but the exercise, I do my best about 4 or 5 times a week to. The facial hair, I tried waxing.
Yeah.
And after a while, they're like, it's not working because it doesn't. The hair is so thick, waxing doesn't get it out. So I ended up threading. Yeah. I wanted to razor. At some points, they were like, I should hold on until I had my baby. So I just kept putting it off. So what I do usually is threading.
Okay.
I'm afraid of the peels because, again, I think it weight adds to your weight. It helps, increase your weight. So I'm a bit weary of using peels. So I just threading for my facial hair. For the heavy periods, you wait it out. that's
I like that. You okay?
Yeah, I just wait it out. It has become shorter after each pregnancy. With each pregnancy, my cycle is the period of my period is shorter.
Mm-hmm.
So it used to be about 7 days. It went down to about 5. Yeah, so now it's about 5. About 5. So I'm looking forward to menopause.
I know. When you say you were going to wait it out, I understand.
looking forward to menopause. See, but that's a question I want to ask though. So, do the symptoms or the effects of PCOS decrease after menopause, or this is something we battle till we die?
Well, the symptoms decrease after menopause. So, yeah, because some of these things, they get better over time. Yeah, there are different kinds of PCOS, but let's just generally they get better when you hit menopause, because those hormones also go to sleep, so it just gets better. Yeah, I'm going to ask you a question now. Let's look back a little bit. If you know what you know now, what would you have done better? Or don't let me say better. Maybe what would you have done differently?
I would have probably gone for a diagnosis much earlier. I would have started the fertility journey much earlier. I would probably have been more careful with my diet from the start. I started my fitness journey much earlier than I did. So I think basically that would be it. My lifestyle and getting to a hospital for a diagnosis much earlier. We waited about 5 years. So if I had known what I know now, I would have done it much earlier.
Yeah. That's what everybody says. Hindsight is always 2020.
Yes.
Yeah, but what can we do, so that some other women will not say what you just said now? Do you understand me? I appreciate that you are here today, because it's not everybody who would do that. Because so I know this is one of the things that you could do to preach the gospel of polycystic ovarian syndrome. But yeah.
I think part of the problem is enlightenment, conversations that we don't have. So I know about the part of the world where I live in. Fertility is a taboo topic we don't talk about. So when you are going to your husband's house, everybody will pray that and you won't menu or whatever, and you expect to go and get pregnant, have your children, and it doesn't always happen. And we don't have these hard conversations. We don't talk about, it's not a question, we're not placing blame. It's not fault. I mean, I'm not responsible for the fact that I have PCOS. It happened to me. So conversations that we need to have much earlier. I think couples should be open to having fertility tests. Just for the sake of it. Because you know what, you can have PCOS and have children without complications. It doesn't mean you don't have PCOS. It doesn't mean you can't develop the heart complications or the hypertension as a result of. So PCOS, the conversation about PCOS should go beyond just fertility. It's a conversation we need to have about lifestyle, about surviving. Because so what if I had had children without this diagnosis, without having to do IVF? I could have gone on to have heart complications. If I'm not worried about my weight because I don't know I have PCOS, I could end up with type 2 diabetes, I could have hypertension, I could have a flurry of, conditions, and I will not know why. Because we don't dig into the why here. We just deal with, okay, what is wrong with you? You have diabetes, and then we don't dig into the reason why what is wrong with you is wrong with you. We just deal with the surface, which is what is going on now. But the conversation about PCOS should go beyond just fertility. I would say, I mean, there's no compulsion behind it, but I would say that if at a certain age, if you can't just go for a full body, go for a test, just make sure you're fine. But I understand we don't have health insurance, and these tests are not cheap, but neither is curing them or managing them. So if you find out earlier, you can manage it better.
I can't agree less. What we do in Nigeria is almost like when you have an equipment, you don't attend to it until it breaks down. We don't have maintenance. We don't maintain ourselves at all. And some of us are even very ridiculous. We say we don't want to find out.
Ignorance is bliss. Until it kills you.
Yeah, until it kills you. So I think, recently somebody was going to get married and somebody was canceling them, and I happened to hear. And he was saying, have you thought about how many children you're going to have? And they said, yeah. I said, okay, what about if children don't come? What are you going to do? That's one thing that many people don't consider at all. Yeah. We take having children for granted. Yes. But the reality is looking at us in the face. That for so many reasons, some people will not even have children 5 years, 6 years, 10 years after marriage. How are we going to cope? So I agree with you. Those are some of the things that we need. And I think women actually have to be in the forefront of all these discussions.
Because, yes, more often than not, right or wrong, the blame does fall on the woman. Whether or not, that's right, that's a whole other conversation. But more often than not, we bear the consequences of whatever choice both partners have made.
The funny thing, why I laugh is that most of the time the prosecutor in chief also is a woman.
It's a woman. This is very true. This is very true. This is very true. We need to start being kinder to each other, and that's the absolute truth. Because you don't know what anybody's battling with. You don't know what anybody's dealing with. You don't know, and Nigerians, we're amazing. We're an amazing people. You're like, you have put on so much weight. You don't know what's wrong with me. Even after I lost my first child, everyone was like, oh, you put on so much weight. Are you pregnant? I'm like, Really, that is such an insensitive question. You don't ask whether or not someone is pregnant. When you see a baby, you know the person has been pregnant and you congratulate them. Otherwise, just be quiet. If you can't help, don't worsen the situation. But yes, it's a conversation that really does need to be had. Even beyond PCOS, we don't
Yeah,
take care of ourselves as much as we should.
yeah,
We don't find out what could be wrong because, God forbid, it's not our portion. So,
yeah. But you know what even amazes me more is that even when facilities for support are available, people don't avail themselves of it.
I,
For
I want
example, yeah, go on.
I want to ask you, have you found religion to be a major roadblock in fertility
That's a
journey?
very that's a very difficult question, tricky question, because we always say science and religion are not opposed to each other. But in reality, most of the time, it's not religion. It's some people stand in the way of science. We saw it with COVID.
Yeah.
When people turn pulpit into laboratories, come on, give me a break. You know, let's God be God. You know, and so sometimes we see people going into fields that is not their own. And anyway, so but I think women need to start having this discussion, trying to support each other. You know what amazes me again in Nigeria, that people that have gone through infertility, they want to pretend as if they never went through it.
Yeah.
Instead
It,
of,
it makes you feel, I don't know why people feel like you are less of a woman because you got help.
I don't know too, but
I
it is
to get help in one thing, somebody gets help in another. It doesn't diminish the fact that both of us are now parents or both of us are now mothers.
exactly. Yeah, I think those are some of the stigma that we need to remove from some of these things. This hocus pocus,
And
that to,
again, I think this is where religion needs to work with science. So, you have all these seminars and vigils in church where, birth like a Hebrew woman. And I think these conversations should be had in those places that, you know what, God gave scientists the sense to get this done. God
yeah,
gave helping the doctors to get this done. So these are the options that are available to you. We need to begin to demystify, like, infertility is more commonplace than we care to think. I remember the first time I walked in here with my husband. I think the shock was just not the number of people, but also the variance in the ages. I mean, you had very young and very old people, and I'm like, and here I was thinking this was just a few of us in this boat.
hmm, hmm,
So
yeah,
we need to take this as well, I think, to churches and mosques. Let this conversation be had in as many places of faith so that more people can get help. So PCOS is not of the devil.
no, no,
And IVF is not 666. We need to we need to have these conversations in places of worship so that people can be encouraged to come out of, some people are coming out and saying, oh, after 20 years of marriage, I finally had my children. They will not tell you what they did to have these children.
no, they
And they
won't.
will not acknowledge the fact that you could have had these children in 5 years instead of the 20 years you spent waiting.
Very true.
I will be honest, my husband pushed the conversation for IVF because I was like, oh
Hmm.
no, I am faithful in waiting on the Lord. And my husband is like, okay. Just remember. And I come from a family where you've got lots of medical personnel. So it was stupid thinking, it was emotional thinking. But I was fortunate that I had someone to push logic
Hmm.
outside emotion.
Yeah,
Some people are trying to push logic and they are pressured by faith.
hmm.
wait on the Lord, wait on the Lord. Well, the Lord is giving options.
Correct. Correct. I mean, seriously, I will have said preach it. Yeah, because it's what people need to hear, you know. For me, I don't have any doubt that there is no contradiction. There is no opposition between religion and science. Because science, I believe, is inspiration. The only person who gives inspiration is God. You know, God has not created anything after 6 days of creation. No new thing. We are the ones that we're just discovering those things. So when he allows us to discover, we will know. You know, so the things that are already revealed to us, if we don't use them, we're on our own. You know?
Yes.
Yeah. So thank you so much for telling us about your experience. And then let me just Sharon Opanachi, Olutukesi, Rosemary, Joma Scholatica, Helen Rege, Ogotuku, Monica Jacob. They're on Facebook. There's some people on Facebook.
Okay.
Yeah. Somebody's asking, is PCOS the same as ovarian cyst? No, not exactly. Ovarian cysts are cysts, they're a collection of water. Polycystic ovarian syndrome they are cysts, but they are very small cysts, usually less than 9 mm. So they're very small cysts, and they're multiple, unlike ovarian cysts that you have just a few. These are like many cysts, and they're not cysts per se. They are follicles or eggs that have been arrested at different stages of development. So I'm just trying to see so that we can take the questions and then so that we can probably go. How about oligomenorrhea? How can it be dealt with in PCOS? Yes, the oligomenorrhea is because you are not, when you don't ovulate, then there's no progesterone. Okay, it's not released. So the fact that you don't menstruate regularly is because the cycle is not completed, in other words. So once you can regulate the cycle, you start menstruating regularly. And that's why pills come in sometimes. That's why progesterone only pills also can do that. But of course, we know that sometimes you can put on weight from those drugs, especially from water retention. Someone is asking what tests can be done to detect PCOS. Yes, we've said that a combination of things, but scan will probably see the polycystic ovaries, but we need to combine with either irregular menses or you have excessive male hormones, which can show in terms of facial hair or body hair, or that you see in the lab, they see that you have excessive male hormones. How can we make the menses regular? We've talked about that. Yeah, there's also, thank you for this enlightenment. Please do people with PCOS prone to coming up with OHSS during the IVF? Very correct. This is flesh. Yewande Olomola. The flesh and blood does not reveal this to you. Yes, it's very correct. People who have PCOS are prone to OHSS, and because of those follicles that we said they are arrested at different stages of development, if you give ovulation drugs, so they can just come up, but most of the time the quality is not the best. So sometimes some things will need to be done in order to make sure that your embryos are top quality. So she's also asking, I'm sure this is somebody who knows a lot about IVF. During IVF, is it better to get the embryos frozen before transferring or better transferred freshly? Oh, okay. That's a discussion that Mrs. Familusi is very skilled at having. Okay, you know what we said about these follicles being at different stages. So the tendency is that when you are stimulated, the level of estrogen is very high because of these follicles that suddenly come alive. And sometimes, we also know that your endometrium and your embryos are supposed to be growing at the same rate. That is the assumption in IVF, that if you're transferring the 3 embryo your endometrium also is about day 3 or like day 4, and then you can get pregnant. So, but because of the high dosage of estrogen, your endometrium might just not be at sync at all with the embryos. And that's why we always sometimes talk about when you produce so many eggs, that is better that you have frozen embryo transfer, apart from the fact that you said again that there's the possibility of hyperstimulation. So those are the reasons why we sometimes tell people with polycystic ovarian syndrome to have a frozen embryo transfer. But before you can do that, you must be sure that your freezing system in the clinic is very good, because if not, you're just going to be wasting everything. So that's that. So Mrs. Familusi, I'm going to ask you to give words of encouragement. What words of encouragement would you give to anyone watching right now?
I would say PCOS is not a period. It's not the end. It's more like a beginning. So the moment you find out that you have PCOS, then you need to chart a new journey for yourself. You need to begin to decide for yourself what it is you want. I mean, not everybody wants children. So even if you do not want children, what quality of life do you want for yourself? If you want children, how soon, how early? If you do, then you need to begin to work towards whatever you want, be it children or just a better quality of life. Also, conversations like the lady who asked the question mentioned, freezing your eggs is not a bad thing, because you advance in years. So you get your eggs, maybe at your first stimulation, you get like 20 good quality eggs. And then you advance in years, your eggs are not as good anymore, but your eggs remain the same. If, like you mentioned, you have a good feeding system. So my advice is, when you find out, then don't sit on your oars, don't rest on your oars. Take active and decisive steps towards whatever end you have in mind. Ask questions, do your research, and again, it's not a death sentence.
Yep. Thank you so very much, Mrs. Familusi. I don't think you will have asked for somebody better to discuss this topic. And yes, I'm sure many people have learned from you, and they know better about PCOS now. You heard it all. It's not a death sentence. What you need is, and is not my portion. So you just need to draw the map and see how do you want to go about this. So it's at this point I'm going to draw the curtains this week. And I thank you so much, Mrs. Familusi, for being here. Everyone who has been part of this program today, thank you so very much. And then we'll see you some other time.
Thank you very much for having me, Doctor. Thank you.
Thanks.